sexual risk avoidance education that is grounded in special emotional learning principles. Zenz's career in education began as a public school teacher. Her passion for youth, holistic success, and for science sparked her interest in SRAE, launching her on a meaningful journey. For the past 11 years, Zenz has taught SEL and SRAE in public and private schools while forming a strong partnership with her county's Children and Youth Services Independent Living Program. As the project director for Penn's Youth Initiative, she applies her education skills and SRAE experiences to the administrative side of outreach and implementation. Welcome, Rebecca, and we look forward to your presentation.
Thank you, Cindy. I appreciate that. I appreciate the invitation to be here. Welcome, everyone. Thank you for your interest in social and emotional learning. I just want to pause before we get started. You can go to the next slide. We're going to start with what is social and emotional learning. But before I start, I just want to pause. This presentation was originally put together by my dear friend, my counterpart of 11 years of working together, Cindy Janzik. She was unable to be here this week to give this presentation because her mother has passed away. So we miss her. We're looking forward to her being back in the office soon, but I am filling in. I'm going to do my best to get into her head today and share with you what I think she wanted you to be thinking about with social and emotional learning. So just to get started from what Cindy said in the introduction, before we get to the definition, I just want to share a little bit about how I came to this social and emotional learning component of sexual risk avoidance education. I was approaching our children and youth program in our county, and it was a brand new partnership. And this was prior to grant, so I could kind of shift things around. I know there's certain requirements that we have to fulfill with the grant, and of course we follow all those guidelines, but I was able to develop a scope and sequence to offer children and youth and their independent living program that was founded kind of in these concepts of social and emotional learning, just to kind of get in the door and get my feet wet and get to know these students and allow the caseworkers to get to know me. And as the caseworkers looked at the curriculum, they said, "Oh, you do soft skills." And I'm like, "Oh, okay, I soft skills." So they teach the hard skills, you know, checkbook, find a job, write a resume, run an apartment, you know, they're doing all of the hard skills. And so they brought me alongside to do soft skills. And so this scope and sequence that I was offering to them, emotional intelligence part 1 and part 2, relational intelligence part 1 and part 2, and then that gave me the platform to then be able to do sexual health component with those students. And so it really built trust with them and helped me forge the opportunity to then do the SRAE in greater depth. So that's just a little bit about my background and how I got into incorporating social and emotional and thinking about it that way, social and emotional learning, into what we do. So we're going to define social and emotional learning. You can go to the next slide, please. CASEL, which is the Collaboration for Academic, Social, and Emotional Learning. It's about 26 years old, this collaboration of research that have put together this functional definition of what SRAE is. I'm sorry, what social and emotional learning is. And so as I read this definition, I want you to think about your programming in SRAE. I want you to think about your curriculum that you use and how many of the components within this definition are something that you already do. And I actually want to ask you to put it in the chat. So as I read this definition, open up the chat and type in there one of the things in here that stands out to you that you already do and already use in your SRAE curriculum. So CASEL defines social and emotional learning is the process through which all young people and adults acquire and apply the knowledge, skills, and attitudes to develop healthy identities, manage emotions, achieve personal and collective goals, feel and show empathy for others, establish and maintain supportive relationships, and make responsible and caring decisions. So go ahead. I see things like all of it, goals, achieving personal goals, all of it, goals. I'm looking at your chats. Thank you for participating. All of it. Yeah, I would say all of it too. And even I can break it down and look at some of these things and think about the things that we do. In the field talk yesterday in track 1, I remember somebody was talking about filling the toolkit. We go and we give the students their toolkit. We want to fill your relational toolkit. And so definitely we're giving them knowledge, but we're also giving them skills. And when you think of norming and when you think of what we're tasked to do as sexual risk avoidance educators, we are normalizing sexual delay. And so that has to do with attitudes. So developing healthy identities. How often do we help students examine themselves and their identity? And we're building up worth and value and all of those things, teaching them empathy, communication skills, goal setting, showing them how to make decision making. I mean, think about the decision making models that we all probably use in our curriculum. So I know there's about 9 authentic SRAE curricula that's approved through Ascend, and I have to tell you, I've only ever really used one of them because I just, that's the one I've used and that's the one we love. So but I'm sure out of all of those, they all have these components. So thank you for sharing in the chat. You can go to the next one. And so I want to dig into CASEL, and I encourage you to go to their website. They have some resources on social and emotional learning in light of COVID. They have a search tool for your own state, like what are the standards within your state for social and emotional learning. So there's a lot of resources on CASEL that can kind of help you, explore what is out there with social and emotional learning. So I want to just break down the framework here. And obviously, we wouldn't have this presentation in today if we didn't think that the social and emotional learning components coincide with SRAE objectives. They're linked. And so these are what CASEL call their 5 competencies. And so I just want to look at this graph for a little bit. Might actually remind us of some other graph that we've talked about, right? The optimal health model of moving away from high risk into lower and lower to risk avoidance. So I'm just going to look at the inside first. And so the 4 competencies: self-awareness, self-management, social awareness, relationship skills, and responsible decision making. And so I just want to break these down for you a little bit, and then we're going to look at the environments that CASEL refers to them as far as where is social and emotional learning happening. And if you think about the human flourishing study that we saw at the beginning of yesterday, the 6 domains, again, it's just amazing how this all overlaps. So let me just break each of these down for you. So according to CASEL, self-awareness is the ability to understand one's own emotions, thoughts, and values, how they influence behavior across contexts. So in our context with sexual risk avoidance education, how a student's emotions, how their thoughts, how their values. I mean, we don't teach values, but we're helping students identify values. Okay, so this would be integrating personal and social identities, helping them find their identities, identifying personal cultural assets. Again, assets are a big component. I don't know what if that's in your curricula, but I know that 40 developmental assets is one big SRAE component. identifying one's emotions, demonstrating honesty and integrity, linking feelings, values, and thoughts, examining prejudice and biases, experiencing self-efficacy. There's self-efficacy. We heard a lot about that yesterday with the optimal health model and the self-efficacy that it takes for a young person to feel empowered, to feel the ability that they have the skills, that they have the resources, that they have the support, that they can move from higher risk to lower risk. What is it in, I remember the doctor yesterday teaching on optimal health, she kept saying, the student's gonna say, what is in it for me? What's in it for me? And the idea of moving from higher risk to lower risk. And so the self-efficacy, so again, rooted in social and emotional learning. The last one here says growth mindsets. I don't know, when you're circulating schools, I don't know if you see growth mindsets listed. I've seen growth mindset journals. I've seen bell ringers with growth mindset. It's built into the school. So social emotional learning is something that many, many, many teachers are utilizing within their own classrooms on a daily basis, which is great. So the next one is self-management. The ability to manage one's emotions, thoughts, behaviors effectively in different situations and to achieve the goals and aspirations that a person has. So again, going back into goals, that the goals are actually there. I think of it when I do a presentation or a lesson on boundary setting. You know, what are your boundaries, and talking to students about setting boundaries. And that's a personal choice, and giving them that tool and that empowerment to begin to set those boundaries and to own them. So managing one's emotions, identifying and using stress management strategies. In COVID world, identifying and using stress management strategies. That's huge. Exhibiting self-discipline and self-motivation, setting personal and collective goals. A lot of you said goal setting in the chat. Using planning and organizational skills, and then showing the courage to take initiative. So it's one thing to put a boundary setting skill into their tool set, but unless they're ready and prepared and feel that self-efficacy and the courage to take the initiative to enact that boundary, it's not going to do them a whole lot of good in sexual risk avoidance. The next one is social awareness. So the ability to understand the perspective of and empathize with others, including those with diverse backgrounds, cultures, and contexts. So the idea here is respecting each other's perspectives. That was always a big, going back to boundaries again, but that was notoriously where it would show up for me in the classroom, where students would very quickly, if I gave a hypothetical boundary or if I shared a third person story about a boundary, the students would, that's so, they would jump on that. And so again, that social awareness that a boundary is a personal choice, and having empathy and compassion, having respect for another person's perspective, understanding, expressing gratitude, identifying diverse social norms. Again, the norm of you know, we are tasked with the goal of normalizing sexual delay. And that's huge in SRA. So recognizing situational demands and opportunities. We often did activities, scenarios that were like a high risk situation, and it was problem solving. They had to figure out how to avoid that risk, or how were they going to get themselves out of that situation. Again, situational demands, social awareness of how, what do I do, and making those big decisions. All right, so relationship skills is the next one. The abilities to establish and maintain healthy and supportive relationships, and the effective and to effectively navigate settings of diverse individuals and groups. And so again, relational, maybe intimate relationships, maybe we're talking about toxic friends and we're navigating friendships, or we're navigating intimate relationships, or parent relationships, whatever those things are. So communicating effectively, how many of you teach communication skills? Developing positive relationships, helping them understand a healthy relationship versus a non-healthy relationship, demonstrating cultural competency, practicing teamwork, collaborating, problem solving. I talked about that in the last one, resolving conflict constructively, resisting negative social pressure. Again, that's a big one for us, right? The peer pressure, giving them the skills and tools in their toolkit. All right, and the last one of these 5 competencies is responsible decision making. So the ability to make caring and constructive choices about personal behavior, social interactions across diverse situations. So again, this could be a friendship, this could be a parent relationships across the board. And how do you solve problems and make decisions in diverse situations? So demonstrating curiosity and open-mindedness, learning how to make a reasoned judgment, analyzing all of the data and the facts. Isn't that what we do as SRA educators? We're going in, we're giving them all the facts because we want them to be able to make an educated decision about what they're doing with their sexual health. Identify solutions for personal and social problems. Anticipate and evaluate consequences for one's actions. Huge. And we aren't just talking physical consequences, right? Optimal health includes all 5 of those: social, emotional, physical, social. I always go the wrong. If I don't do it in order, I get myself confused. So physical, intellectual, emotional, social, and spiritual. And we talked about that in one of the presentations the other day with optimal health. Okay, excuse me, a little tickle in my throat. So the next component, or the next thing I want to do with this framework, is actually look at the blue circles, which represent the environment where social and emotional learning is taking place. And these can very well parallel, and that's what I'm going to do, is think about how these parallel with what you do with your sexual risk avoidance education programming. So first, I want to start with a little pause, because when I think about us teaching components of social and emotional learning within SRA education, social emotional learning, I don't know about you, if you sit in on a curriculum training, I always come away with something for myself. and you know, I have expectations that I don't speak to my husband, and then whatever it is, or things that we can apply to ourselves. We just had a curriculum training, and listening to the reflections just touched my heart. But so I'm going to pause, because as an organization, I want to first challenge us. Let's start with us as an organization. So if we are tasked with teaching healthy relationships, social and emotional learning, to lead us, to build a framework for sexual risk avoidance education, then we ourselves should be strong in social and emotional learning. We ourselves should have strong, healthy interactions and relationships within our own organizations. So first, I want to challenge you with that we would be representatives of healthy relationships across the board in our own lives. So I just want to start there. It always starts with us. So in the framework, the first circle in the blue is the classroom. And so any school district, components are, improper, okay, hi Tracy. The components are, so classrooms are the first circle there. And so social and emotional instruction and classroom climate. And so social emotional learning that's going on in the actual classroom. So that could be, like I said, with the growth mindsets, a teacher has embraced growth mindsets, and there's a journal, and there's a bell ringer that is encouraging students to self-reflect, things like that. So a teacher could incorporate that at any time into his or her curriculum within the classroom. It could be math, it could be science, it could be social, any of them. And a lot of times, if you look at the social and emotional learning standards for a state, they will start at like a preschool level, which makes sense. And then it'll go through early elementary school. But I don't know if you've ever, I don't know how much, I mean, sometimes it'll go in through the middle school, maybe in character education. But I mean, think about how those components are so important to be threaded all the way up through high school. And so it's an important concept to think about of what we have to offer. So first, it's in the classroom. And so that would be how the school is embracing and using social and emotional learning. But it's also what we do. If you're invited into a classroom, what classroom climate, what do you do to set your classroom climate? That there's social and emotional learning and safety. Do you have a norming? Do you have an opportunity for the kids for the young people to, what do they hope to get out of this, or what would make them feel safe in the classroom? Really approaching that classroom climate with that trauma-informed social emotional learning safety place. And so I don't know what you do to sort of set those standards of conduct to set classroom climate. Just that's one thing I thought of with sexual risk avoidance education. Using proper terminology. What are the standards that you set when you're doing an SRA program? The next one is schools, the next ring, the blue one. And so this is school-wide culture. So that's what the administrator, the principal, maybe the guidance counselors, that's the entire school, even all the way up to the school board. What is their school-wide culture and climate and policies and practices that they are embracing for their school? And how does that fit with social and emotional learning? And how can you, and so I really want to challenge you, I mean, now serving as project director in Penn's Youth Initiative, I'm thinking more on a marketing, like how can you come alongside what they're already doing? And yes, you're tasked to do sexual risk avoidance education, but you are so skilled at teaching social and emotional learning. So you have the components of social and emotional learning that you have to offer a school district, a school-wide culture, to say, allow me to come alongside you. And yes, we need to hit the sexual risk avoidance piece, and we will get there. But we have so much of this social and emotional components that we build on to get to the sexual risk avoidance piece. And so just, the concept of optimal health and all of those pieces that go in. So the next category around the outside is family and caregivers. And I would say this is the area that I would like to learn more. I would love to do a better job of how to reach families and connect with caregivers and support them. And CASEL's approach, they have what they call authentic partnerships, where they want to see schools embrace families and caregivers in linking them with social and emotional learning. That it's not just come see the art that your student made, or come see the school play or the athletic event that's going on, but authentic partnerships of how can this change. And I think about community saturation model, and how can this change? How can we link all these community partnerships together to make a difference for youth? That social and emotional learning and sexual risk avoidance education is echoed, even after you're gone out of that school. It's echoed and it continues. So that's just something I was thinking about, and I would love to hear in the chat a little bit more about how you reach families and caregivers. We've always done a parent-teen home assignments type thing that allows teens to go home and problem solve with their parents, at, especially at a middle school level, where they're kind of gives the parent an opening door to begin to talk to their student about dating, or talk to their student about boundaries, or talk to them and set a plan of risk avoidance and things like that. So that's kind of how, but I'd love to hear more about that. And the last ring around the outside in CASEL's framework is communities. And that's really where we are. As SRAE teams, we can come alongside, like I said before, come alongside the school and support them. And so don't think of yourself as an add-on that you need to sell to the school or apologize that you have this and you need X amount of days, but just the idea that you have more to offer than just the sexual health component, but you have sexual health components in relation to social and emotional learning. All right. I think I'm ready to go on to the next slide. And I'm looking forward to looking at your chats here soon. So the next slide, and just a little bit more, I think I said this, but CASEL, out of all 50 states, I think there's 21 states in the United States with social and emotional learning related web pages where it provides guidance and resources. 18 states throughout the US have standards in K-12 on social and emotional learning. So I thought that was an interesting, you can always look that up. For us here in Pennsylvania, I think it just comes down to career readiness is what they have as standards in social and emotional learning, which some of your curriculum may actually cover as well, career readiness and things like that. But so this next slide is actually from a brief that connects developmental relationships, equitable environments, and social and emotional learning. And so this gives some information about middle school and high schoolers were polled and kind of gained some information about what were the impacts of developmental relationships and how did middle schoolers develop them different than high schoolers. And so I'm going to share a little bit about this, but this is from the Search Institute. So you could find it on Search Institute. The link is down at the bottom there. But developmental relationships defined by Search Institute are close connections through which a young person discover who they are, gain abilities to shape their own lives, and learn how to interact and contribute to the world around them. And so developmental relationships are one of those safety nets that that the Search Institute has really identified, provide a safety net for young people, especially at risk or higher risk young people. And so the statistics here are a little bit of the data outcome. And this was measured with, did the developmental relationship expand possibilities for the youth? Did the developmental relationship express care? Or was there shared power? Or did it provide support for them? Or did it challenge their growth? And that's us. We definitely challenge students to grow. But developmental relationships, what they identified at the Search Institute is that more middle school youth reported having strong developmental relationships with teachers and program staff than high school. And so it really, then I'm sorry, I get distracted by those chats that pop up. So we probably would identify that middle schoolers are probably going to build those adult relationships, those developmental relationships a little bit easier than high schoolers. That's what they found in their study. The second part of this is really significant for SRA programming if you're coming alongside as a supplement. outside of school time. And so they found that stronger developmental relationships were actually developed outside of school time, like an after school program, for example, with directors and staff of that program, 70% over the 40% of school teachers. And so that's just a little bit of information about kind of that social and emotional learning and how that links to developmental relationships. And along with that data, you can go to the next slide, please, is also some of their, some quotes from students. So staff make me feel like I matter when they be kind and notice me, have real conversations, help me no matter what. And so you can kind of see that this is communicating acceptance, it's communicating worth. They're feeling accepted, they're feeling worth, they're feeling valued. So important for us. And I know I'm preaching to the choir, I'm sure here. But the second one really stood out to me in the world of sexual risk avoidance education and how it links to social and emotional learning. I don't know how many times you've been in a classroom or been in a presentation and the students are like wide-eyed, like, is she really talking to us about this? Like, wow. They are so appreciative of real conversations that we're willing to talk about it real, just talk about it. And so I just want to encourage you. I'm sure you're all doing all of that. And I am encouraged that I'm talking to a wonderful group of SRAE educators. You can go ahead and go to the next slide. I know it blesses your heart when you see quotes like that come through. Now, this is somewhat of the bad news, not that this is a surprise to anybody or new to anybody, but I know Cindy included this. Dr. Robert Redfield from the Center for Disease Control in July, he was on a webinar series being interviewed. And one of the things he talked about, he was asked about schools reopening. And he said, it's not risk of school opening versus public health. It's really public health versus public health. And when he said that, he's talking about the side consequences, the things that are going on with our youth because of school closures, because of the isolation, because of the screen fatigue, because of not seeing their friends or losing a sport or whatever. And so the suicide rate has skyrocketed, drug use, all of the things, all of those risk behaviors that we're attempting to address that all cluster together with sexual risk. And so I just want to encourage you, one of the things that we've done to try to help in this scenario, our particular curriculum has a Save a Life suicide awareness, and we just slip that in the back of every student workbook. It's like, can we please just put that in the back of every workbook so that if we're in a classroom and there's been a suicide or somebody knows or the conversation comes up. We also use referral. We put referral phone numbers and always provide the suicide hotline and other helps with drug and alcohol. All of those referrals we put we just have a sticker that we print and we put it right on to our workbook. And I don't know how many of you do that, but that's just a way that we found to hopefully combat the circumstances that we're currently in with the youth. And this just shows how much more of a need for social and emotional learning. And really, this is a time to educators, school boards, administrations, they're looking for help. They're looking for help, and we have tools that can help them. You can go to the next slide. Thank you. And so whether it's in person or remote, we need to address those needs and some of the ways I just described that we are addressing them and just targeting and talking about social emotional learning and mental health when we approach schools, that we're not a one-trick pony. We have a lot to offer as sexual risk avoidance educators that we may not have even tapped into or thought of. Go ahead and go to the next slide, please. And so in closing, I have a couple slides here that I know Cindy built in, and I couldn't fully gain all that she was trying to say here, but I'm going to do my best. But I just want to start by saying, of course, every social emotional learning delivery as SRAE delivery, it's always equitable, it's always trauma informed, it's always inclusive. That's a given. So I remember when I was teaching as a public educator, my supervisor coming in and observing me and saying, oh, I saw, and we sit down to debrief, and he says, I saw you use this strategy and this strategy and this strategy. And I'm thinking, I did? I didn't know I used those strategies. So I'm telling you that story to say that I know I'm talking to phenomenal presenters and people probably with teaching gifts and abilities. And so the quick few slides that I have left here are hopefully just fun things to say, you already do these things, and kudos to you. So let's go to the next slide. So being honest about your own social and emotional needs. So this is kind of goes back to me talking about our organizations. If our organizations aren't healthy in our relationships, you know, it's hard to go talk about healthy relationships. So admitting our own needs, taking care of ourselves, and being willing to have those authentic conversations. Go ahead and go to the next slide. Number two, empathizing with students and sharing relevant stories. These are all COVID related that Cindy had listed on here, and you know, maybe sharing some of those things in the chat or what, you know, just talking with kids and allowing them space to talk about the struggles of the conditions that we're in. But also authentic, relevant stories. I know I was just on a presentation with Tracy Pike, and she said, I'm a storyteller. I am too, can you tell? And so for me, I always shared that my parents were divorced whenever I would present. And one of the reasons I would do that was I didn't want the kids to think I lived in some fantasy world, that every relationship was roses and, you know, cream. So just being real with students and being authentic. You probably already do that. Next slide, please. Okay, so facilitating engagement with participants. Again, if it's remote learning, there's lots of tools. I'm sure many of you have tried lots of them. Chat boxes, polling features, addressing participants by name is always a wonderful way to gain their attention and engage them. Probably things you do. Go ahead on to number 4, please. So inserting humor, I'm not very good at this. That's why I married a funny guy. Smile, be creative, laugh at yourself. I definitely could laugh at myself, but I'm sure you probably do those. That's part of being a good presenter. Go ahead and go. So, and incorporating music. This is something I have not really done. That I would love to do is uplifting, something with safe lyrics, of course, music maybe without lyrics, using it in those break times when students are doing think time or breakout sessions, that kind of thing. And so with that in mind, we're going to actually close with kind of a fun social music related video. So go ahead.
Very uplifting.
Doesn't that make you smile?
Yes, it did. Okay, we thank you so much for your presentation.
Sure.
And now we're going to open it up for questions. I do have a question that I would like to ask you. Michelle, can you go back a couple slides? I think it's 3 slides back, please. There, be honest about your own social and emotional needs. Could you share with us maybe some ways that you help your staff working on the program? Any kind of training or meetings that you have to talk about this, to help them be comfortable being honest with their participants?
I would say that Cindy and I pretty much lead by example in this way.
Okay.
We're just very authentic, very real, very willing to show our shortcomings or our weaknesses. I think one of our favorite lines is, we're learning as we go. So I think that's just, it's kind of a way of life for our leadership.
Okay, great. Thank you so much.
Just to add to what you said, Rebecca, as a presenter and a program director in my past, I would like to challenge my educators and the speakers here on the Zoom to know your limitations as far as how long you can be on most of the time, and do really take care of yourself, get sleep. But, I'm personally not good after 4 presentations in a row. Like, I'm like, wait, did I just tell that story? Oh yeah, this is new kids. And all classes deserve your best. So I know I'm personally not good after about 4 presentations. It's not to say I couldn't do 5 or 6, but really, you can't give all students your best energy when you get tired. So I like for people to set their own boundaries. We teach boundary setting, so we set our own boundaries. And then also, second thing is not to vent on other people outside the industry, like your spouse, your children, like about the woes, because they don't love what you do, like you do, and they might not be passionate like you are. So, they might go, well, then quit. Why would you put up with that? And I think it's dangerous to vent or, spill over onto people who, well, it's also emotionally intelligent not to do that. Right?
Sure.
So those are just a couple tips I think.
Very good.
I could address that.
Thank you. Those are awesome.
Yeah, thank you so much, Tracy, for your comments.
And I did notice your comment earlier, Tracy, about it's not what we teach, but the way we teach it. And I would say that's true, although there are some lessons I know that would fit right into a social emotional learning, actual lesson plan. So, I mean, I agree. I think that that's true. That's the framework from which we're teaching SRAE. Yeah.
Right. Yeah, I was just speaking that it wasn't, it's not a particular curriculum. All SEL can be applied to all curriculum. It's the way we teach the curriculum. Yeah, sorry that interrupted your conversation.
Oh, that's okay. I thought I used the wrong. She's correcting my grammar.
No, I wasn't. I was correcting my own in the comment I made.
It's okay. I noticed Andrea said, what SRAE program do you use that matches with SEL? I don't know if you're asking for curriculum. We use Real Essentials curriculum, which is very much just a relationship education, and it has so many components. And of course, any curriculum is vast, so you don't have to pull from all that's in there, but that's what we use.
So, Rebecca, there's one comment in the chat that one of the participants indicated that some curriculums are, they're not encouraged to talk about their own personal life experiences. So I guess it would depend on the different curriculum.
I'm not really sure. I guess it would depend on maybe school policy or organizational policy. I'm not really sure.
I think there is a little bit of a difference of not talking about your own sexual experiences. I think that would be highly inappropriate and professional. But sharing personal information, I mean, I'm telling you, whether you just say, yeah, when we moved, we built a fence for our dog. It was like a boundary for safety. Like any type of personal information, kids just perk up like, oh, you have a dog. You know what I mean? I think there's a lot of personalization comes in a lot of forms. You just have to, I definitely agree, be very professional about the way you personally share. I hope that helps.
Yeah, I'm reading some of the feedback on what people do with parents. Yeah, looks like there's a parent liaison at the school. Wouldn't that be great? Parent liaison. I want one of those. Workshop for parents to give some stronger communication strategies. That's awesome. Any other questions? Participants, any other questions?
One of the participants commented that they're encouraged to establish boundaries, but humanize themselves, which I think is very relevant. Okay, well, if we don't have any other questions, we'll turn it over to Julie, and she can help us transition into the next portion of this session. Thank you so much, Rebecca.
You're welcome.
Thank you, Tracy.
Thank you, Rebecca. Thank you for being here with us today. And thank you, Cindy, for being our moderator. This is going to take us into our next session, Field Talk, Key Takeaways for Adolescent Thriving. Thank you so much for joining us for our Field Talk, Key Takeaways for Adolescent Thriving. At this time, I'd like to introduce Tracy Pike with Ascend.
Thank you, Julie. Welcome back, everybody. I hope you got to stand up and stretch for at least just a minute. We have heard a lot of great presentation information this morning or in this afternoon, and I think the value of this is sitting among us. You know, you all who are in the field, we are in a track for not first-time grant recipients. So as Rebecca alluded to also, you know, you're the pros. And so we want you guys to be able to commingle your own thoughts together. And there's no better way to do that than in a facilitated, a semi-facilitated, but not so much facilitated dialogue with one another. And so we are going to launch into some breakout rooms here in just a moment. And with that, we have a couple of self-guided questions that we would like for you to bat around, and then assign yourself a spokesperson for your breakout group. And then when we come back together, we will be able to just hear and learn from one another. There's just such power in that. And a lot of our feedback indicates that that's really important to those of us in attendance. So what we're going to ask you to do is share the most significant takeaways of this day 2 training. And here are a couple questions to ask yourselves as you know, what you can be batting around in the breakout rooms. The significant takeaway you learned today, it doesn't have to be just from Rebecca's amazing presentation on SEL, but all things that you have talked about through the day, even from our opening conversations about social media campaigns. The second question would be, what innovative social media campaigns have you implemented or seen used or have had success with in your programming? So 2 things. Key takeaway number 1, what's your key takeaway? And number 2, what kind of social media campaigns have you seen working for your organization in program? So I believe we have breakout rooms structured, and they do take a few minutes because there's several of us on the call. So if you'll be patient and please do dialogue with those in your group, just if for nothing else than to a networking opportunity as well. There's just such power in us having conversations together. So I believe our time together will allow ample time for these types of conversations, and then we'll come back and have a little dialogue with your spokesperson to share.
Okay,
Julie?
the breakout rooms are now opening.
Great. Welcome back, everyone. I hope you found that productive and helpful. I know I was assigned to a group and we participated. I was in chat group room number 4, whoop, whoop. And we really enjoyed getting to know each other, just talking about where we are from and what was so helpful for the day. So I know we at least had 4 chat groups going. So why don't we hear from each of the groups with the spokesperson, just sharing the type of conversations you're having, which is your key takeaways, and if you employ any type of social what do you call it? Media campaigns. There you go. So I'll go ahead and let you guys, well, can they unmute themselves, Julie? I'm not sure. Why don't you raise your hand, perhaps?
Oh, yes, if you raise your hand, we'll make sure that you're unmuted.
So if you see how to raise your hand on the bottom.
Okay, well, I unmuted myself, so.
Oh, okay.
Mike Ellison. We were group number 9, and we talked a lot about just general information about each other and what we were all doing. And some of the significant takeaway was a lot of the information that was shared on yesterday and from the different presenters that we had on yesterday.
Okay.
And some was mentioned about how they was doing the little movies and the virtual, what is it? Virtual reality. Yeah, we was talking about that. And then in terms of the social media, some are using TikTok and having kids to do those and send them in, and they kind of pick a couple of them. And then they're also showing them during their class time when they're with the kids, so they can kind of see them also. And some are like the campaign that we're doing. I'm lost for names here.
The We Think Twice, the one that was.
Yeah, We Think Twice campaign, using that. And some are not using it yet, but in the process of preparing to do that and to use it on their Facebook page.
Yeah.
And there was some suggestions about some other things that people could do. And we also talked about the IRBs and some of the difficulties that some of us have had
Yes.
with getting those, and how difficult that was for some of us, especially in schools, and some who were exempt from that due to evaluations that they were doing, doing the implementation evaluation. So
Wow, it sounds like you guys talked
if any of
about
my team members had anything to add, just shout it out. I think I
You're
covered
good,
it.
Michael. You guys covered a diverse amount of topics in that short period of time, really.
Yeah.
So thank you for sharing.
Oh, we did there was one recommendation that I know when we used to meet in person, we had contact information of persons who attended. So
Okay.
that, I don't know if that y'all can do that some type of way virtually, because a lot of times you hear stuff people say, you want to, I've been writing down people's names. So you
Sure.
probably want to get their information and kind of follow up with them on some of the topics that they discuss, questions.
Okay, I will pass that along. And don't forget, at the end of each day, we want the feedback. So there'll be time for that feedback. So if you wouldn't mind putting that in there, I think I saw that from someone else's feedback yesterday.
Okay.
That, they really wanted the contact information for those willing to share. So there might be a way to do that. So thank you so much, Michael. Thank you for sharing.
Uh-huh.
Way to represent Group 9. You guys rocked it. Carissa, I see your hand is up. Would you mind unmuting and sharing your video and tell us what group you're from?
Oh, hi, Tracy. Yeah, let me turn my video on. There.
Oh, I didn't mean to push you to do that. Just to see your face.
Actually, I don't know what group we were in. We had an awesome group that had lots of great discussion, but I do not know our group number.
Okay, that's okay. We didn't either until we found it at the very top of our screen. So no problem. Go ahead. You'll represent well, I'm sure.
Oh, Mariah says we were in group 7. Okay, thank you, Mariah. Okay. Okay, yeah, so our significant takeaway for a lot of us was just how much, the suicide rate has gone up, and how much we need to incorporate suicide prevention and just awareness inside our groups, in our schools and our classrooms. We had a lot of we had some people who were teachers, some people who were more trainers or facilitators, but the takeaway was definitely that's a really important piece that needs to be highlighted and incorporated in our programs. And how could we do that? We also talked about, Ohio talked about how they were just starting to add social emotional learning standards, and they thought it would start about this fall.
Mm-hmm.
And anyway, and they were talking about how they've been talking a long time about how important those pieces are to help empower students. We also had a conversation about the teen outreach program. Is used here in Missouri as well as Nebraska, and it already has a lot of these features built in and is a really inclusive, holistic program.
Okay.
We talked about how we could use the community service learning, maybe to tie in some of those pieces on suicide prevention if the kids were interested in that. We also talked about, in regards to the social media, it seemed pretty standard. Almost everybody was using Facebook accounts to try to get information out to adolescents and youth, but that Some were also using TikTok. They were using Snapchat, Instagram, basically any social media source that they thought would reach our population.
Yeah.
They also discussed doing trying to start up a podcast, which I personally thought was really awesome. A podcast that the student leadership group, there would obviously be parameters for it and adult guidance and oversight. But just another way to get out those positive messages and build those relationships.
Yeah, that's really cool. Yeah, a podcast. That would be a big undertaking, wouldn't it? But that's awesome. Thank you, Carissa. Way to represent Group 7. Again, I'm really glad. I know some of us felt like, the time might have been a little, like we finished talking about a minute early, maybe 2 minutes early, and then some of us didn't have enough time. Does anybody else want to share from your group what you all talked about? See, the quicker you go, or the sooner you go, then people don't take what you were going to say. You don't have to just unmute and go ditto.
I can share. I can share. I was in group 2, and I think there were 3 others that popped in and shared with me. So Jonathan was from Florida, and he's relatively new and getting into it. And Michaela, I think that's how we're saying her name, is from Nebraska, and Wendy is from South Carolina. And so we were all from all different regions, and we were sharing about our takeaways. And so social emotional learning, Wendy was intrigued and talked about some of the aspects of it. And we talked about strategizing, how to reach out and get into schools. Like, how do you get them to open the doors? So we talked about that. She said they were thinking about doing a demonstration through video to promote their programming. And I just encouraged her to check with the curriculum company that that's an okay thing to do, just because there's, copyright standards and things like that you have to take into account. One of our partners actually created a 2-minute YouTube video. She did it over and over and over again until she got it under 2 minutes, because she wanted it to be short, that people would watch it. But she was promoting the programming, but not necessarily demonstrating, content. And that seemed to really be a very good way to potentially, just email that right out to schools, to teachers, to administrators, that kind of thing. So it is a potential. And then we talked about these social media, and for me, I don't like to reinvent the wheel. When I listen to We Think Twice, I'm so excited about what they've produced, and that it's tested and that it's tried and true. So we have not yet implemented it at Penn's Youth Initiative, but we will be. So we will be. And I think that's about it. Michaela from Nebraska, she is a professional public health, a state health professional in public health. So a lot of this is review for her, but at the same time, she was, excited about how to help and maybe pass some of the information down to their grantees.
Yeah. Thanks, Rebecca, for stepping in and speaking for your group too. Looks like Tammy, I think you are representing group 4.
Yes, I got it. So for a lot of us that were in group 4, it seemed like some of today, the STD information and the SEL information was good review for us. At least for our program, which is in South Carolina, we have a strong STD element of our curriculum. And really, today's presentation just reiterated the importance of discussing sexually transmitted diseases, but also our program incorporates teaching STDs from a social emotional learning perspective. So not just teaching the facts about STDs, but helping the students to feel something through the presentation. So asking them feeling questions and just using some social intelligence and emotional intelligence in order to make the information actually change their behavior. We know information alone doesn't change behavior, but if you affect the heart and make an impact there, it'll have a lasting impression on them. And we actually train all of our educators in social intelligence, emotional intelligence, and social emotional learning. So some of the other people did talk about the We Think Twice campaign and how they're using it in their programs. We even discussed some barriers to how we've been able to not use that campaign and how do we overcome those kinds of barriers. And I think that's a big summary without repeating what everybody else has already said.
No, you did a great job. You did an awesome job, Tammy. Thank you so much for stepping up and doing that. We tried to get one of our members. She's brand new to the field, and I said, "Do you want to share?" And she's like, "Please no." So, thank you guys. Thank you for sharing. I think there's a few more groups that have not responded. We'd love to hear from you because I'm hearing diverse things from every one of y'all's. It looks like Devon Johnson raised your hand. Where are you, Devon? There you go. Tell us about your group. What group are you in? Before you do, Devon, let me just make sure we're going to run out of time in about 3 minutes. So can you do it in 2 so I can make sure everybody fills out their survey? Go, what you got?
Sure. All right, so I was in group 3, and I was in a group with, I believe, Brenda, Betty, Brittany, James, Isabella, Gonzalez, Ramonda Henderson, Shirley Johnson, and we had a nice discussion about some of our takeaways, one of which was the social media aspect and how to get youth involvement through that. So we did look at the Instagram page of We Think Twice, and we saw how colorful the page was with all the different youth-friendly content, videos and pictures and audio and text. And that was a great way to get the students to be engaged through social media. I know it was mentioned about Facebook, but I know that a lot of the youth that we serve are on Snapchat and Instagram. So those are the platforms that we often use to engage youth. And one of the things that we're going to try to do to implement in our programs is giving incentives, because we want more than just a youth to like a status or to like a post or to follow the page. We want buy-in. And how do you get buy-in? You give incentives. Hey, if you join this youth workshop, then we will give you an incentive. If you share this information to others to make people aware of the program, you'll get this incentive. So incentivizing the youth through social media gives a lot of buy-in. And we talked about the A through F implementation and how we can, like it was mentioned in the earlier breakout session, how we can make sure that we teach all the content because it's all important, as you mentioned. And so we just went over some of those points, making sure that you share your personal story less, making sure that you limit sidebar conversations, making sure that you give out SRAE handouts to the youth to look back at on their own time, just ensuring that you ask for more time in the school, if possible, to ensure that you have enough time to do all of your content. So it was a nice discussion, and we were grateful to have shared with each other.
Yeah. Hey, Davon, really quick. I know we're running out of time. We have 1 minute left. What kind of incentives? I see somebody in the chat saying they give out incentives based on level participation. What does an incentive look like? Like
that was me. I'm sorry.
No, that's okay. But what does an incentive look like?
So like Walmart gift cards, things that the youth especially in rural areas, that was very helpful. And even during the session, levels of participation will get you $5 gift cards to fast food restaurants. So first awesome. In, first back from the break, chat, all that good stuff.
Oh, that's so cool. Thank you guys. Thank you for sharing.
Sorry about that, Devon.
You off. I appreciate it. And thank you guys for stepping in to share. We have put again in the chat the link. Julie is just putting it again to the SurveyMonkey. Would you please fill that out today? Because it really helps us get better and give you in the future material and stuff that is helpful to you and just give us feedback. So thank you guys today for finishing out day 2 strong with us. And we cannot wait to see you again on day 3 right after you log off, or before you log off, hit that SurveyMonkey link and take your survey for the day. And everybody have a great evening. Thank you.
Thank you, Tracy. Thank you, everyone. This will conclude our session.